very good evening to everyone present here for joining us today. On behalf of IIHMR Bangalore, it's my great pleasure to welcome you all to today's webinar, Women Leaders Creating Impact in Healthcare. I'm Dr. Sakshi Shimpi, PGDM student of first year, and I will be the co-moderator for today's session. On the occasion of International Women's Day 2026, IIHMR Bangalore proudly brings together inspiring voices for a meaningful conversation on leadership, impact, and purpose in healthcare. I would like to take this opportunity to introduce you to the IIHMR Bangalore campus. Thank you, ma'am. IIHMR Bangalore is a premier institute for hospital management, and health information technology management established in the year 2004. Currently, we are serving specializations in AIDS, artificial intelligence, and data science, one of its kind and first in India. Now, moving ahead with today's webinar. Today's leaders are transforming healthcare through purpose-driven leadership, innovation, and compassion. This year's theme, Give to Gain, reminds us that true leadership begins with a contribution. When women leaders give their knowledge, courage, and mentorship, they don't just uplift individuals, they transform systems, organizations, and communities. And in giving, they gain stronger teams, sustainable impact, and a legacy of change. It's my pleasure to welcome and introduce the speakers for today's session. I welcome Dr. Sunita Maheshwari, a pediatric cardiologist with global clinical and research experience, trained at Yale School of Medicine in USA. She is a board-certified American Board of Pediatrics and Pediatric Cardiology. Thank you so much for joining us, ma'am, today. We are grateful to have you. Our next speaker for today's session is Dr. Reema Nadig, co-founder and director and group COO of Lifebridge Group. She is a leader in senior living and geriatric care innovation in India, completed her MBA in Hospital and Health Administration from CSM Institute, Goa. Thank you so much for joining us, ma'am. Now I would like to welcome Ms. Neha Cadabam, Executive Director at Cadabam's Group, psychologist and mental health leader driving behavioral healthcare initiatives and advocated for integrated and accessible mental healthcare ecosystems. Thank you so much for joining us, ma'am, today. I welcome the moderator for today's session, Dr. Usha Manjunath, Professor and Director, IIHMR Bangalore, Birla Institute of Technology and Science. She holds a MPhil and PhD in management from BITS Pilani, an academic leader with extensive research experience and healthcare management and leadership development experience. Thank you for joining us, ma'am. Now I invite Dr. Deepa Shri ma'am, Assistant Dean Academics and Student Affairs, Assistant Professor IIHMR Bangalore, to conduct a quick poll on the occasion of Women's Day. Over to you, ma'am.
Thank you, Sakshi. Thank you for all the participants who have joined us and the speakers. Today, we are celebrating the Women's Day with the theme Give to Gain. So let's understand the perception of our participants on a basic few questions like women's on leadership, what are the barriers, what is the healthcare opted by women. So let's have a quick poll. And I would request all the participants to participate in this poll so that our speakers also would get a fair idea of what about the participants in this event. So let me start the poll. Now in your screens, probably you will be seeing quick 5 questions which you have to choose one among them, right? So the first question which talks about the barriers. So do you think women have a barrier to reach the leadership? If yes, what it is? So I think we can have people can opt on a quick poll, right? Requesting all of the participants who have joined us to put your perception or remark on the questions. So the first question is about the barrier. Why women are not going up to the leadership? Or do you think what is the most biggest barrier for a woman when they are going to the leadership role, right? So still 50%, we have one participants and only 7 of them answered for the first question. I think requesting everyone to participate in the poll. Okay. The second question, which talks about the neglected women health issues. Okay, do you think that health issues of women are neglected? If so, which is the least attention gaining health issue of a woman by the society? So please put your remarks on the second question. Moving ahead, we have a third question which says that, do you think that digital health technologies will improve in accessing healthcare by a woman? Right? We have speakers who let us know what is their perception and what's the facts, right? So the fourth question is empowering women in careers. So here we talk, do you think what is the important factor that is empowering women in careers? Do you think whether the leadership, whether the financial, mentor and networking, which helps a woman to be in an empowering women to empowering women? Do you think which is the important factor, right? The fifth question is about the organization support. So if you think that what could be an organization support a women professional should get to lead, to make an impact, right? So we want all of you to answer this poll, and this will help us to understand the perception, and our speakers will also fine-tune your perception at the end of this, right? Requesting all the participants to take up the poll. Still, we have only 41% of people participating in it. Yes. So these are the common answers that we got. It's not a fact figure. It's a common answer, common perception we have got from different people. We wanted to know your perceptions too on the barriers, the barrier for a woman who are aspiring as a leader, which is the health issue ignored by herself as well as the society? And do you think the digital technologies can improve the healthcare? And do you think what is the important empowering factor for a women's career? And what are the organization support you're looking if you're a woman and working in a healthcare organization, right? So 47% of you have answered. I will be ending the poll in another 30 seconds. Yes. Okay, thank you for responding, people, that they have completed and putting up the message. We would like to request the participants to attend the poll, and which I will be closing now. We have received around 50% of participation answers for this, so I'm closing the poll now. I wanted to bring attention of all the speakers as well as the moderator, Dr. Usha ma'am. We have received the poll. And the first question, what do you think is the biggest barrier for women aspiring a leadership role? So the highest vote was given to the gender bias in the leadership position. I think this is the perception which is answered by 23 people. They feel that it's a gender bias in healthcare in the leadership position, which is the biggest barrier for them. The next question is, which is the women's health issue do you think receives the least attention? 55% of them voted for mental health. They feel that it's the neglected in the society.
Dr. Deepa, can I intervene? Can you scroll down the answers, please? I'm not able to see all the answers for the second question.
Ma'am, are you able to see now?
No, I'm able to see only the first question and not all of them.
I want, Sakshi, are you able to see the second question and poll?
Yes, ma'am. The second question is visible.
But I can only see two responses.
I think you will have to scroll down.
You have to scroll down.
Yeah.
Okay, sure. Thank you.
Okay. Yeah. The third question is, do you think digital technologies can improve healthcare access for women in rural healthcare? So 61% have said that yes, to some extent, they feel that digital health technologies can improve women's access to healthcare. The fourth question, which says that, what do you think is the most important factor in empowering women in career? I think this got a mixed answer, and 33% said that it's a financial independence, and 15% said that it's leadership opportunities. They are thinking that's an important factor. Mentorship and networking is the 26%, and supportive workplace culture is the 26%. So this is, I think this got an equal opportunity for all the options what we have. The next is, what type of support does women professional need the most from an organization? To this question, we got 49% of participants answering that equal pay and growth opportunities, it's what they are looking at from an organization. So I think we have a lot to discuss on this, right? So moving, I'm handing over the sessions to Dr. Usha Manjunath, ma'am. Ma'am, over to you.
Yeah, all right. So thank you, Dr. Deepa. Thank you, Sakshi. And, a very warm welcome to Neha, Dr. Sunita, Dr. Reema. And I think this is a great, opportunity for all of us to, start conversations and hear from the leaders. And with this, I kind of congratulate everyone and tell, kind of looking at this special day and the occasion that we have on the Women's Day, International Women's Day, and marking the day we are conducting this webinar on understanding about women leaders creating impact in healthcare. And of course, the overall theme this year is about Give to Gain. This year's International Women's Day theme, Give to Gain, underscores the principle that meaningful progress on gender equality requires deliberate contributions from governments, institutions, and individuals. When we invest in women's education, safety, rights, and leadership, we strengthen societies. And this is, a fact that all of us know. The campaign's message is clear. Gender equality is not a concession, but a collective benefit. We are from an educational background and a lot more that we do with healthcare. We have also understood, if we really look at give education as one theme, we have seen that girls' education is proven to have wide-ranging benefits. We all have seen in our own lifetime that when we educate a girl, we not only transform her life, but also those of her family and community. According to research, an educated girl is more likely to invest 90% of her future income back into her family, helping the next generation stay healthy, nourished, and prosperous. So let us see how, a lot of these, whether it is education, it's also known to impact on, marriage being pushed further if she's educated. It reduces child marriage, adolescent pregnancy, gender-based violence, and child mortality, and promoting gender equality and health. Therefore, if we really look at a lot of these factors, it's also very nice that we heard from every women and men participant to really see, what are some of the factors that are very important for leadership roles and how we can really move ahead. There are some very specific pointers, and we will take it as we go along. So first round is all about the leadership journeys that the great women on this platform who have joined us, and thank you once again. So let's look at breaking barriers and building the vision. And my first question is to Dr. Sunita Maheshwari. In your profile and, as we look at you, it says you describe yourself as a chief dreamer. I thought that's such a wonderful, designation to have. What was the dream that sparked the Telerad and RxDX group that you have been a founder and a co-founder for? And what resistance did you face while scaling it globally, or developing that whole concept to real company that you floated?
Well, thank you, Dr. Usha, for having me, and happy Women's Day to everyone who's out there listening. I think I don't like my title anymore because, Chief Dreamer suggests that only some people can dream. So I think I should be dreamer, and I think we all need to be dreamers, really, in today's day. In terms of how did we get on this entrepreneurial journey, because I am a doctor, pediatric cardiologist, so it is slightly unusual that I'm also an entrepreneur and running a global teleradiology company as well as a chain of primary care clinics called RxDX. But really, it was very accidental. My husband couldn't get a job, and we moved back to India from Yale University. And so we ended up setting up a company. And I have half Marwadi blood, so I became more of the business person in the group. And then I also have a HR skill, so I became the HR person in the group. So it was all quite accidental. Having said that, I think the dreaming was not one big dream. It's not like one night, waking up in the morning and saying, like Nelson Mandela, I have a dream. It was more lots of little dreams. It's like dreaming every night, and then coming to work the next day and putting those dreams into action. So I've realized that dreaming alone doesn't cut it. You kind of have to also add the pushing and the doing and the closing the loop on everything. So I changed my title. I am now Chief Dreamer and Loop Closer, closing the loop. But in terms of resistance, initially our organization was a teleradiology one with a headquarter in Bangalore, but covering hospitals in the United States. And although we were trained at Yale and we were US trained and we had moved back to India, I think the biggest resistance was the color of our skin, being brown. And it's interesting, I saw gender bias. 37% of women on the poll today felt that gender bias kept them back. We for us it was that brown was the, we were working in a very white field, all American companies, and we were this Indian company. But it also drove us because we felt we wanted to create something out of India for the world that India could be proud of. So sometimes a bias can also be a good motivator and a pusher. So I would say for all the women out there who feel there's a bias against them, use that as a way that I'm going to main dikhaungi, as they say, and push past that bias.
All right. Moving ahead, I mean, that was very nice. I mean, in terms of the, working and having a company working with America, having the brown skin and maybe the, gender bias, and then how that itself, pushed people at Telerad to really work maybe double hard and then really make this win. All right. So, Dr. Reema, what were the toughest leadership decisions in building Lifebridge Group, especially in a traditionally male-dominated healthcare ecosystem?
Good afternoon, everyone. It's wonderful to be here, and happy Women's Day to everyone, including the men who are on this call. Thank you for joining in. The biggest challenge, I think, when we started working, this elder care and the senior living, the senior part, it wasn't very well known, and we were concentrating on out of hospital care, not like the regular, the acute care hospital, which is traditional. The biggest challenge we are finding is people wanting to understand our dream, wanting to fund our dream. In fact, I'm sure the kids of the MBA would understand something called as scratching out the hidden needs. I think that's what we did 10 years back. People didn't even realize that it was a need for them. We recognized it and we started bringing it out to the surface. So they start opting for the solution that we were creating for them. So I think, yeah, to create customers and to create people believe in our idea and to be wanting to investing into us was the biggest challenge that we had. And
Okay.
yeah, and now we are here today across South India for now.
Okay, so it was not so much the male-dominated, maybe the healthcare ecosystem
Yeah.
that they found, but they found that it was more of the accepting of the idea itself as, out of hospital care and maybe later moving on to elderly care and so on. Now to Dr. Neha. Mental health care leadership requires a lot of emotional intelligence and resilience. And what personal experiences shaped your leadership style at Cadabams?
Yeah, I'm in the field of mental health care. I think when you are in the field, I think resilience, I would say, probably is the most important word that we need to use here, because when it comes to someone getting help or seeking help for mental health itself, I think is a journey that they have traveled. It takes a lot for them to say, okay, I am going to go get mental health care services. And I mean, the recovery is not, it can't be linear, it can't be always growing upwards. So there's a lot of, oh, I did this but they didn't come back, oh, I'm trying this, people get better and then they sometimes discontinue and you're wondering if they're doing okay or they're not doing okay. And being in the field where you're delivering mental health care, I think you always have to have high level of empathy, patience, and resilience. So I think the best thing for me when, while working with teams was leading by example, talking to them stories of vulnerability, of we all have good days, bad days. What is important is to be aware of it, talk about it. So having regular interactions with the teams, be it any team, the kind of issues they're going through, talking to them about the challenges they're facing, identifying their challenges and working with them and nurturing and helping them to work in the field and telling them it's okay. The journeys always aren't always progress. And yeah, I think that's what it would be.
Okay, so yeah, we understand the challenges that the mental health and the recovery periods take, and I think you said it very well in terms of as leaders and ourselves, maybe high level of empathy as well as there is going to be vulnerability among us also as leaders, as team members, and that you had to kind of work around that to really build your team and build that resilience to move ahead. Great. So we will just have a little, as we move to the next round of discussion, I would like to kind of give some, statistics in terms of the latest study that has been done by KPMG as well as AIMA in India in 2026 on the women leadership in corporate India. So 79% of the women professionals aspire to hold leadership roles, yet only 1% currently occupy the board level position. And 10 to 30% leadership positions as per 24, and somewhere there has been variations and sometimes a downward trend. And among the respondents, 65% identify the mid-career stage as the time when women are most likely to leave the workforce. And 28% of employees alone believe that evaluation process is genuinely fair and transparent at the corporate offices. So, going back to the second round, maybe I will again start with Dr. Sunita and look at, the focus. I mean, she has been, she herself is a cardiologist as well as, an entrepreneur and worked a lot in digital health and technology. So maybe we will start looking at, with that background in, your experience as a clinician as well as a digital health expert. How do you see digital health technologies helping the bridge, kind of bridging the healthcare disparities for women, particularly in rural or underserved communities? Maybe telemedicine or diagnostics or the digital platforms.
Yeah, I think, I think digital health has been a great leveler in a sense, because, traditionally people in cities had access to hospitals and clinics and doctors, whereas if you were a little outside in rural areas, you had to travel or commute to get access to medical care. And that has changed with telemedicine. And I think we all saw that during COVID. In telemedicine before COVID was illegal in India. I mean, as a doctor, we could be put in jail if we did telemedicine. I used to find that kind of a bit, incredulous almost. And then COVID came, and of course, Government of India made it very legal, and it completely boomed during the COVID years. Telemedicine has tapered off since then a bit, perhaps because patients like face to face, and we're all human. And no matter what AI is there, we like humans in the middle. But certainly for people who are in rural areas, remote areas, it's been phenomenal. I mean, I do telemedicine, telecardiology, and their patients in a small NICU in the middle of Chhattisgarh who will be standing in a field saying, my baby's in the ICU, and they're saying this, and what else could I be thinking of doing? So they've got access then to an opinion from a doctor somewhere else. Today you can send your ECG, you can send if you have an X-ray or images and get a good diagnosis if you don't trust the diagnosis in the place you are. So telediagnosis has made a big impact. I think government itself with the e-Sanjeevani platform has enabled a lot of almost free telemedicine. So I think, yes, it has in that sense democratized healthcare, and can and will continue to do so. I think telepathology, not yet implemented much in India. But again, if you worried about your smear or your biopsy result in a remote part, you have the option to get a second opinion. And getting a second opinion can be very empowering, because if you don't trust the first one, at least you think that you feel like you have another option.
Wow. I think the example you gave on, NICU care for the baby and the mother standing in the middle of the field is kind of really, really moving. In other situations, do you think it has also helped and empowered or reduced barriers for women in other areas of health too? In terms of, like you said, maybe, you did say about telepathology, but then there are many others where they may have concerns. So if you can put a small,
Sure.
yeah.
Yeah, I may be stepping on Neha's sphere, but I think tele-counseling and tele-psychiatry, because traditionally nobody wants to come to a clinic or a hospital to see a psychiatrist or a counselor, and particularly women. So I think in that sense, tele-counseling has really taken off in our country, and it really benefits women who perhaps cannot leave the home, who perhaps are shy to go out, and be in, behind the camera in the privacy of their home. They can talk to a doctor thousands of miles away who they're never going to meet at the food market next door. So I think mental health, I think areas like menopause, I think again, it's, you don't need a gynae exam. You just want to talk to someone, and it's deeply uncomfortable for a lot of women. Sexual health, these are areas people don't feel comfortable face to face discussions, and having a very anonymous way to reach a doctor makes that kind of advice for them much more accessible than before that. And of course, preventive healthcare. I think of today, people are taking Monjaro along with their life coach and all on telly. They're not walking into a doctor's office. So you don't have to be going and saying, I'm overweight, blah, 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 and feeling embarrassed. You can get your whole health, nutrition counseling, your treatment, everything online today. So I'm hopeful that will change, what women do for their health when they have access to these things around them.
All right. So now moving ahead a little bit, do you see, so we saw from the perspective of women actually using digital technologies to kind of take care of the health. So now in terms of women participating in health tech innovation, so we look at all the participants, there are a lot of, people in, the group who are young, who are probably going to be entrepreneurs, who are going to do a lot of innovations. So what do you think in terms of health tech innovation and leadership? Does barrier exist still, or what's your advice to women who would like to start off, their, tries and ventures in digital health technology?
Yeah. See, I think digital health is very well suited to womanhood in a sense, because if you get it right, you can do this work from home. It's all tele, right? So in that sense, it's a very good area for women to enter. Having said that, I've seen a lot of health tech companies that build a solution and then get frustrated because neither the patients are using it nor the doctors are using it. So I think if one does want to set up a startup from scratch, it's important to spend time with doctors, spend time in the hospital, spend time talking to those patients, perhaps experiencing it as oneself, and then really figuring out, okay, what is the need here. I think Reema said something about stretching out hidden needs, searching out hidden needs. So it's the same when you want to do a startup. And sometimes we feel there's a need, but when you actually go to market, everyone's like, no, no, I don't need that. I can put it into Chat GPT and get that today. So I think really spending time in the healthcare ecosystem, seeing also what's already out there, so you're not replicating it, and then coming out with a strategy for what you want to build and how you want to go to market differently from what's out there. It's not always easy. And I think a lot of the aha moments for people come when they've actually experienced something like elder care and, a fall of a mother, and then they figure out that they need, support in the bathroom, and then they need anti-skid things so that they don't skid. So a lot of times we have experiences from what we've experienced, and that leads to an idea. But one can also do it quite systematically. And I think seeking out mentors helps. Just saying, not asking for funding. I just, want to run this idea by you. What do you think? And being open to the suggestions that come through, because we may think it's a fantastic idea, and we take the kind of the input that the universe gives us as well.
Yeah, just to close, I mean, there are interesting and many comments, as well as, one person saying that she has been in a pharmaceutical industry and, a board member. And I think congratulations, and we are very happy that, my 1% probably would be much higher very soon. And then there are also people are asking, like, integrating, drawing from your experience, Sunita, how can emerging women leaders balance clinical impact with research innovation, such as integrating AI for personalized medicine, while mentoring the next generation in resource-constrained settings like those in rural Andhra Pradesh? A quick answer, and then we will move on to the next discussion.
So the question is, how can women entrepreneurs manage AI and healthcare today?
Yeah, clinical impact with research innovation, such as integrating AI for personalized medicine, while mentoring the next generation.
No, I think that's a good question. And I think no matter what we do, we must continuously do R&D, if you know what I mean. Many times we think as R&D as a separate entity, but I think in a very vibrant entrepreneurial organization, R&D is very much at its core. So if I could give you an example, we do teleradiology for hospitals now globally. We cover 150 hospitals. 7 years ago, we started working on AI tools, AI diagnostics. So picking up strokes, picking up fractures, picking up pulmonary embolism, and that was only an R&D effort. Today, that is integrated into our workflows. So many times the R&D we do, which is adjacent to something close to our heart, can then be added into our workflows, with time. So having a research mindset in whatever we do is incredibly helpful. Today with AI, your R&D is so much more, as everyone knows, so much faster. You can do things differently, and you can definitely use that. I think rural medicine in Telangana can change very rapidly today, because even farmers are looking for rain forecasts on using AI today. So why won't they be able to look at healthcare and get solutions from it? And maybe just they don't know how to put the prompts in. Maybe you have something simple that overlays the AI that helps them, which is in Telugu, and explains it to them. So I think using a combination of your R&D, your knowledge of the local community, what AI has to offer, we can have very quick and powerful solutions. Then it will depend on how much we convince them to actually use it, and of course, whether we can monetize it.
Okay, so I'm sure there'll be many more questions, and maybe if there are more questions, we will keep posting it to you later too, and maybe communicate to our participants later. Thank you on that note. And just a quick this one, because the question was Andhra Pradesh. Andhra Pradesh is investing a lot in AI, as well as there's a lot of things that they're building in Vizag to various other places. So I think there is going to be a lot of opportunities for men and women to really innovate on AI and others, even in healthcare. Moving ahead, looking at Reema on the women empowerment, career breaks and women. I know many of our participants are young, so probably the result when they gave about planning for elderly didn't come up as a major thing, but probably as we really look at women getting older, women live longer, women may not have financial support, women may not have this one for planning their elderly years. So in terms of empowerment, we can talk a little bit on a few things for young women, and then move on to based on your experience in the elderly care. Women empowerment, we work at home. We also work outside. I always say, double kinds of works that we do. Of course, poor and the middle class have to put in a lot more. Studies show that probably men are slow to change. So what are your thoughts on women empowerment? And
Amazing. I think it's just up my alley. Question. So 20 years back, Avatar of Me was a hardcore feminist. And over the years, I've realized that, we need not be the same as what others around us are. So we should be, this is our concept also, give to gain. Absolutely. Studies have shown that women are more emotionally more resilient than men are. They are able to, maybe that short physical strength may be lesser than males, but overall strength when we talk about a marathon run of life than a sprint of life. I think the females are able to deal with it much better. I think it is genetics. So I think there is no competition over here with what women and men can do. But empowering, it all starts when it's social conditioning. It all starts when we are younger, the family that we come from, the educational background that we have. How much do we use our educational and experiences that we gather outside to either fight the familial conditioning and come out to do whatever you are aspiring to do? So, very important is to learn the surroundings. When you are aware about what is happening around, I think is the first step to empowerment, that this is what I would like to do and like to be. Getting inspired so that later on you can inspire is also a very important a point of empowerment. And when children are young, of course, 2 decades, 3 decades change the way we think. There's a maturity changes, etc. And uh, 200 years back, or right now, or 50 years later, I think humans, us, we will never learn. We have to burn our hands to learn. How much ever we will tell, it is not going to change. So, point is that take those risks and jump. You have to learn to do that. It is not necessary for you to pass all the time, because mistakes and failures are only teaching us how we have to be. So one thing that, the conditioning that we have at home also is don't fail, only pass, study hard, only pass, don't make mistakes, all those things. So I think that kind of deters all of us. I mean, I'm sure I'm talking for both the genders over here, but empowerment, I think, starts from asking yourself a question: what I want to be. I mean, I think there were a lot of questions that you asked me from career breaks and young and elders, etc. So I think I will start off from the empowerment from the younger age of dreaming and wanting to do, learning from your environment, and getting prepared for what I want to be and how I want to be. When we are working, I think that's the working time from 20 years to 40 years is the learning time also. Learn. Learn not only the subject that you are working in, but learn how do you have to navigate. Now, of course, there has been an evolution of the workspace or evolution of the way the people are accepting how females are. I'm using certain not so welcome words by me, but just to make people understand. I don't like that we need to take permission or be acknowledged by people. We are us independent. So, but the way the world has changed, um, I am very, very optimistic that the world is continuously changing and allowing this gender to flourish more, because they are seeing what kind of value this another gender is bringing in, how they are improving the overall societal structure or the lives of the people that they touch. So I think, and that only comes because the females are driven because they want to prove. That is why every day becomes a better day. And that is why we are able to give the better outcomes each day. So I think those 20 years are very great to, make your position very strong and consolidated. And by the time we touch our, middle age, that's the time is when we start taking care of ourselves. That I am going to be now, whatever we do, we are going to live up to 100. So the retirement age of 60 actually is stop working, start enjoying. So the 60s are more new 40s right now. So how do we prepare that I have 30 more years to enjoy? What should I do to keep myself healthy, physically, financially, mentally? I don't want to be dependent on anyone. I think none of our generation are expecting anything from our kids. Say you do deal your life, we will deal with ours, and we are making our lives. So I think this evolution of thinking is very, very important for each one of us to think that it is me, an individual, and I'm going to be making my own life, and I'm going to be taking care of my life 40 years hence. Nobody else is going to do that, because every single individual have their own problems to deal with. Whether it is your spouse, whether it is your sibling, whether it is your kids, they have their own problems to deal with. So we need to deal with our problems ourselves. And So empowering starts there also, that how we think and how we start choosing to be independent in all aspects is very, very important. And I will not even go into that mental health, physical health, all those things I think are taken. It is just about the thought that we need to bring in, that I need to take care of all those things. So that is very important. And the way we are brought up, the societal conditioning that happens, we are not pushed to think that. So I think today I will take this opportunity to talk about not the obvious, but the unobvious, and push ourselves to, be a very independent individual for as long as we are there. I hope I answered your questions.
Yeah, I think, yeah, you did address a lot of that in terms of, early upbringing to, making ourselves stronger. So I really like the fact that, you were like 20 years back, maybe a hardcore feminist, but now I look at it as, maybe, yes, I'm in here for a longer this one. And partnerships are very, very important. As well as I like the way you put it in terms of the life cycle as how we plan. Just one quick question. I think it had also come in various studies. It has shown in terms of, women tend to take career breaks. Even Indra Nooyi has talked about, the biological clock versus the career clock. They tend to clash maybe. And so therefore, in terms of taking those time off in between, and how does that really impact, and how do women brace up for it? Maybe one at the when the children are born, and the second when they are little growing, during their adolescent, and yeah.
I think when you have to have a kid and the kids are really small, I think that's the time when the kids and the family needs you. That's the time you are taking care of a extremely dependent being. So I think it makes sense that, and it is not wrong. It is not wrong, and I think the society and the family has to, and the person themselves don't have to feel guilty about it. It's not wrong. And again, it's a personal choice. There might be some people who don't want to do this. There might be some people who would want to do this. I think both the decisions are right. Both the decisions don't make either. You should not feel guilty about it. But the life is evolving. I think, again, 100 years back, I didn't think our grandmothers worked. But from our mother's time, the women started to go to work. So there was a change in the society, right? When our generation came to work, we are working more than what our mothers worked. Our kids are in a very different zone altogether. I mean, their way of life, the way they think life is very, very different. I don't think kid is making them pause anywhere. It's kind of another thing that is happening in life. So it is not changing at all. I think as the kids grow older, I think it is our responsibility to make them feel more independent and be by themselves. Why should a mother take a break when the kid is giving a 10th board or a 12th board? I don't think it is necessary. They have to be independent by that particular time. Again, it is my personal thinking. People will think something like that. It is my purely my personal opinion. We are creating adults. Why are we not making them independent? That is one question that comes. But there might be mothers who would say that, no, I would like to sit over there, otherwise I will feel guilty that I didn't spend time. All right. So my request is, I don't think there is anything to be, there is nothing guilty. You're not doing anything wrong by not being there to teach a 16-year-old to teach. So taking a break or not taking a break is absolutely personal choice. But if you can, when we are asking on one side that we should be given equal opportunities when we are growing in our careers, and in the mid part of our career is the time when we can take that skip up, why the break? Why are we wanting people to understand our problems or our condition of life and saying that, okay, I need this benefit? I think that probably is counterproductive to our ask. We are wanting to be empowered. We are asking that, we are equal, but we are asking for special privileges sometimes. It kind of does not make sense to me. So, again, personal choice of taking breaks, but we have to remember that these breaks, any action will have an equal and opposite reaction, right? Newton told that. So, we have to be ready. If I do this, this will be the consequence. If I do this, that will be the consequence. We will have to be ready with that and take those informed decisions, which would depend, which would have a lot of variables to think about. It could be family dynamics, it could be personal aspirations, it could be XYZ reason. But one thing is, when we take a decision, we should not feel guilty about it. We should just go with it full on and then finish that and get on to our journey again, which would have pulled us back. But well, that was our choice. We will reach there again, maybe 3 years later, but we will.
Okay, so that was a straight answer coming from a strong, women person, and also the kind of a clause that it's a conditional this one, that it's a personal decision. Definitely, it's always good to hear from strong women and saying that this is possible. I mean, the break is your choice. If you take break, don't feel guilty. But readjust, and when you come back, be prepared to kind of face, as well as build your career back into the pipeline. Maybe we will, in case there are some more time left, we will kind of revisit some of those. And moving ahead with Neha. There are a lot of things that are happening, and whether it is from the policy perspective, all across India, all across the world, there are a lot that has, been talked about. Maybe we can say a little bit more on the mental health, that it's coming out of the closet, and that therefore there are changing trends. So starting with, in terms of work-life balance, do women have that luxury, or most common mental health challenges that women face today compared to maybe a decade ago? Are there some early signs? So who should they reach out to? How should they really deal with their own health? So there are two parts to it. So I assume that all the working women are looking for work-life balance. At the same time, there is going to be a lot of issues and challenges on the mental health. And so if you can tell us how, in your experience, that you have really worked around these areas.
Sure. Work-life balance, I think a word that we all battle with, I think, on a day-to-day basis. I think somewhere work gets balanced, life gets balanced, but the me gets lost. I think if I have to be honest on that. But it's really about, how each one, picks and prioritizes what is it that they want. What do they want from themselves? What do they want from their life? And what is it that's really a priority for them? I think I remember my mom saying, you have to study hard, you have to do well because you have to be independent. And I think the goal that time of me growing up was, oh, whatever I do, I have to make sure I'm independent, financially, emotionally, all of it. So I think today a lot of when I look at a younger generation, many of them are not really thinking of, oh, I need to work hard, I need to earn more, I need to save for the future. Whereas it's more about, as long as my today is taken care of, I'll figure out what I want to do tomorrow. So, but I mean, honestly, if I have to talk about work-life balance, it is definitely a very difficult thing, a hard thing, because I see most women having two full-time jobs, one at home and as a mother, as a wife, taking care of responsibilities at home, plus taking care of work. And I see most of them struggling, they start early, they end their day late because they have to juggle and they have to manage both of it. So there's a lot of juggling, multitasking, obviously leading to a lot of burnout, and difficulty managing emotions because there's a lot of exhaustion both physically and emotionally because the mind is constantly running. In fact, there is research which says because of the amount of thinking the women do, they need more hours of sleep than the men. So yeah, I mean, we're constantly thinking of all of that. But I think what is important, instead of having a conversation about how should women balance things better, I think we have to really change the spotlight to, how do families, organizations, and all of us as a community really come together to redistribute responsibilities. I mean, we know clearly it is happening partially. I see a lot of work from home men, who want to be there at home to support their partners with responsibilities at home. But yes, I think we have to really look at how we are able to redistribute responsibilities so that there is a lot more, work-life balance for the women folk. And clearly, the support system, I think, um, has to be there at both places, at work and at home. And like Dr. Reema rightly says, it depends upon where and how you look at empowerment. So I think empowerment really begins from home. I think in India, with a lot of joint families, etc., the whole ideology also of, oh, I didn't have it easy, so you may not have it easy. So I think it's also about empowerment beginning at home, where one person or one woman can support another woman and, really help all of us grow together.
Okay, so that was a great this one on maybe I'll reframe again on the mental part. So I think mental health part. So work-life balance, I think that was a very nice saying that you said, work gets balanced and life gets balanced, and I'm lost in the middle. Me probably is lost in the middle, but then rightly said that whether it is at home or the institutions and how they can really support, and how we navigate, and also along with the families how we really do it. So on the mental health scenario, the kinds of things that you deal with in your clinical practice, in terms of maybe it could be recognizing that the women, we require help, recognition, awareness, to actually seeking help, and maybe the stigma around it. How does this really play out?
So I think mental health and seeking mental health services. I think the challenges that women face today. I mean, the World Health Organization says that women are twice as likely as men to experience depression and anxiety, and you have 1 in 5 women who say that they have experienced symptoms of depression, anxiety at some point of time in their life. So, I mean, yes, the kind of challenges that women go through, in terms of, it could be burnout, body image issues. I think a lot of social media comparison, caregiver burden. I think the mental health challenges that they go through are much more than probably what men would go through. And it is important that, as women, we try and be aware, like you said, while there is stigma. I mean, I know there has been a positive trend. People have been a lot more open to reaching out. There has been a shift, but still somewhere the stigma does stay. The first step comes awareness of, I'm aware that probably I'm going through some issue. And the next is accepting that I should reach out and get help and not wait for a big crisis. So, just like how we focus on physical health and care for our physical health, important for us to care for our mental health as well. So identifying early signs of, emotional outburst, feeling overwhelmed, feeling anxious or guilt. When I'm at work, I have a parental guilt. When I'm at home, I have guilt that my work is taking a backseat. Try and understand if there's, persistent fatigue or mood fluctuations. So try and identify what would be the signs and how we can, really reach out and get the help that would be required at a much earlier. I mean, like Dr. Sunita was saying, telecounseling has really opened up avenue in many ways. We see a lot of homemakers reaching out to us for help. We see a lot of new mothers, who's going through postpartum challenges, hormonal changes after delivering the baby, and it's very difficult for them to step out. Or even conservative joint families, for them to really step out, answer to the family where they're going, why they're going. So, the access to the online and offline spaces, I think has opened up more access. Of course, there's still a long way to go. What we're talking about is urban, but we also have to look at what is happening in the tier 2, 3, and 4 cities in terms of what is the accessibility do they really have there.
Mm-hmm. Do you think, in your experience, the telemedicine that telecounseling, Dr. Sunita was also talking, or even maybe reaching out? I know we have, mental health, number that we can all call. There's triple ITB, and NIMHANS have started that at least as a first line of this one. Every time we see in the news that there is, and the number is promoted for people on suicides. So can you throw a little bit light that people could really go ahead and support and spread this awareness so that people kind of have access, know where to reach?
Right. I mean, today, information access or access to help is at multifold. Like I said, first comes awareness, then comes acceptance, then comes access, and then comes the affordability. So there are various and multiple options in terms of helpline and other places where people can reach out when they're looking at online, be it just mental health issues or suicide helplines. There are a lot of government organizations like the Sahai and the Nimhans and the others, and a lot of private organizations, including Cadabams. We have our helpline, which 24/7 people can reach out, and they could talk to us, and you will have a psychologist on the other side of the phone who would be answering. And even in the other helplines, they are trained to manage mental health crisis, like we would call it, psychiatric crisis, and we would work and help with them. So there is a lot of options available. Although I would say still the mental health gap, the mental health treatment gap is a lot more in terms of what is required to how many people are able to seek services. But I will say we have moved ahead, and the access is a lot more compared to what it was probably a couple of years back.
Okay, so so let me see if there is any specific questions to Dr. Reema and to Reema. I think they also think your reply on don't feel guilty, and this is how I would do it. I think liked your reply, and wonderful, Dr. Reema. And I think we really need very strong leadership and women like you, Dr. Sunita, and Neha saying, hey, go ahead, it's okay to make mistakes, or it's okay to kind of take breaks. It's okay, but then keep moving ahead and do what you want. And then so there's again appreciation from Neha to Neha Cadabam. And she says, in terms of, Indian women usually follow and, different aspects of life. So maybe a quick additional one, what's your take on gut and mental health connection? So it's a very specific question, but you could, if you think you want to answer that.
Yes.
Yeah.
Yeah, I mean, the gut-brain connection is definitely very strong. And I think, again, like I said, like the awareness is gradually rising about mental health care and the need. Also, the gut-brain awareness that, there is a connection, there's a very strong connection there has been coming in the forefront. However, there is still a lot more, because it's an interdisciplinary field. I think there is a lot more collaboration that has to happen between the experts, so that when we're looking at a person, we're able to look at them holistically and work with them with evidence-based practices to have the best outcome. Clearly, I think it's very common. If I would say, if you have to cook for the family, the women want to go all out, but if it's only for me, I think I'll just probably have something of either what's there, or I'll order something in. So yes, the focus on self-care in terms of what I'm consuming has to improve, and a lot of interdisciplinary work has to happen in this field.
Okay, so so what I will do is, as we move ahead, creating a support system. But maybe I would take, there's an interesting question. So in terms of the, we all as women experience a lot of ups and downs in our hormonal, kind of landscape that really works sometimes for us and sometimes against us, maybe. So how to drive these innovations, with combining therapy with like tailored pharmacotherapy and conditions like postpartum depression, if you want to put some small this one onto it.
I think what I would like to say is working on any person holistically, where we focus on the biopsychosocial, the biopsychosocial model that we work on, where, you cannot work with a person only with medication or only with therapy. we need to try and look at the person holistically. And I think it is very important to try and see how we can bring in different modalities, have different professionals come together to be able to work so that we're able to address any concern, any health issue more holistically than just in isolation. Very
All
brief
right.
and quickly, if I have to answer, I think that's what it would be.
Okay, so yes, I mean, it's not only pharmacotherapy alone, it can't be one versus other, but I think you said like biological, social, and psychological would be the best way to really look at a holistic, treatment plans. Just I will continue and ask you one last questions. And how can organizations create psychologically safe environments for women to thrive? I mean, yeah.
Uh, I think that's very important. Like I mentioned earlier, we all need to come together to create more psychological safety, if I can say, where we're able to create environments where people feel safe, non-judged, and comfortable, where they're allowed to be themselves. I think create an environment where, be it your colleagues or your people you're reporting to, your employers, etc., they're open to who you are and how you're feeling. I mean, I remember, I think it was another webinar and we were talking about it in terms of if someone has to put a sick leave, they'll feel very, very comfortable to do that. But if someone has to put a sick leave as a mental health day, people have really thought twice. They're okay to put it as a sick leave, but if they have to put it as a mental health day off, they have this fear of being judged. Tomorrow when I go back, they're going to ask me, what happened? Are you okay? Can I give you more work? Can I not give you work? What state of mind are you in? So to be able to, at that point, instead of saying what is wrong with you or, what is the issue, all you can say is whatever you're going through, I'm here for you, to be able to show that sort of a support. And also, I think people in the leadership who are able to model vulnerability, we're all having, like I said, good days, bad days, to be able to talk about it so that even people in the organization can model from you in terms of, okay, it's okay to be vulnerable, and it's okay to seek help sometimes. And the next would be flexible work policies, where sometimes based on the other commitments that you have, if you're able to accommodate some sort of flexible work policies, keeping the industry in mind and the kind of industry they're in, that gives them a little bit of flexibility to accommodate the other things. I mean, mostly on Women's Day, you see posts with women in cape, superwoman, superhero. I think the truth is we are not superwoman. We're not people with cape. We are human as anyone else could be. We also need help. We also need support. We also have bad days. The only thing is we should be able to be okay to say that I'm not okay today, and I'm going to take a break or I'm going to get some help. And I think as organizations, to be able to provide mental health resources today with AI and a lot of changes, many of them are looking at mental health resources and support in the best way possible. So to make this as much as accessible for employees, and you have a lot of these corporate wellness programs where actually help is given and not entertainment, because in the name of EIP, some psychologists are expected to deliver fun Fridays, etc., where we're actually able to focus and talk about real mental health issues and concerns and able to reach out to them. I think that's
All
something.
right. Dr. Reema, what specific initiatives have you taken to mentor and promote women in your organization? And, how do we take it forward? And Lifebridge and Kites, I mean, you're working in the elderly care a lot more. And, so therefore, this is a very important one coming up. Yes.
Yep. So in our company, 60% of us are women. And so that's one proud thing that we go. And if anybody was on LinkedIn of ours, so we had put the statistics out. So that is one part. And definitely, I think women empowerment are giving that space or pushing the females to do what they aspire to do, I think it's a top-down approach also. So me being at the position I am, I think I am, it's easy for me to say this, not for many others to accept it, but for me being where I am, I think I make it very, very, um, it's a mandate that everybody has to be on the same platform. So whether, if it is flexible hours, it is flexible hours for all. If it is, anything that anybody, no, there is no gender bias over here. So that's the sense of equality that is bringing in our organization, because the men are also counseled how to create that environment. It is just not the women that, okay, you can do this, you do this, you be this. So men are also, counseled to do with for their colleagues as well as what they can carry back home. That's one part of it. Uh, we are continuously encouraging females. I think the one thing that is working out very well for us is because it's the same kind of rules that we apply for both genders. That is making the whole atmosphere very good over here, and anybody will come up to a managerial or leadership level if they deserve it, whether it is men or women, right? So we are only helping towards pushing them to upskill, pushing them to read, pushing them to go beyond their job descriptions. So that is what, how is it that you can make yourself a spark? How is it that you will be picked? So those are the mentoring that is happening, not because you are a female, because you deserve it, because you could be better, right? So these are the things that we do in our organizations, for women and for men, and they will be picked from their credibility, from their skills that they are doing.
All right. I like the fact that, it's not going to be any different for men and women. And I really like that, both need to be mentored, both need to be coached, and, we go for it. Okay, great. Dr. Sunita, in terms of, I know many of us sitting here are financially kind of independent or empowered, or like, maybe some of them are students who are going to be soon getting jobs and really doing it. But it has different colors, the financial independence. I kind of remember when, a few years back, or I always made it sure that it's my account and I handle my own account. But there are women who depend on, their husbands and, kind of managing that and not really get that opportunity to deal with it on their own. So in terms of financial independence that play in a work women's life, and maybe tips for young and old and whoever. Yeah.
Yeah, no, I think it's a tricky one if you're not working, because clearly you don't have your own
Right.
income. And my mother was a homemaker, and my dad used to give her a certain amount per month. And I still remember as a kid finding that very odd, that she got kind of, to me, it looked like pocket money, but it was the money to spend. But she did save. She would save every month out of that. And then, she was American. So every few years, she'd save enough to buy her ticket to visit her parents. So I think even for a non working woman, if you can spend less than you get in your hand, you can put it away. Certainly for a working woman, I think we have our own bank accounts. It's important to keep our own passwords. It's important to discuss financial, what's going to be the framework at home with this. If we're earning equally, should we share expenses equally? If we're earning less, should we share less? I mean, what's the equation? Because as Reema said, if we're asking for equality, then we can't say my earnings are my money to spend and your earnings are for the home. So I think you need to sort of think through your own framework with finances. But having said that, very important to make sure we spend less than we're earning, keep some for a rainy day. When you run an organization, try and have cash reserves. Example for us during COVID, obviously, everyone was cutting salaries, cutting jobs, and we chose to continue to give salaries and not let go of anyone. And the minute COVID ended, everyone was still there, and we became a much more vibrant organization because people were so grateful. So I think fiscal prudence. And, I sit on the board of HDFC Bank. So one of the initiatives we have through our CSR is actually training women on financial literacy. And I think that's extremely important. And I think many women in India are not trained, and globally. They live on trust. They live on trust that their husbands will look after them, or their in-laws, or their parents. But I think financial literacy is an essential part for every woman. And today you can do it on, you can, on YouTube videos, you can take courses. There are lots of ways to get there. But saving and learning to invest is essential, I think, for all women.
Great. So far we had a very enriching and a very interesting talk about starting from, women empowerment to digital health to, how do we manage our own, mental health, as well as providing support, and also as organizations and individuals, mentoring and coaching. So my last round, and I will come back to Neha with a, rapid fire question. So I have three for you, Neha, and then you could take the answer. So ambition in women, is it admired or judged?
That's for me?
Yeah.
Okay. Sorry, can you go again on that?
Yeah. Ambition in women, admired or judged?
Admired.
All right. One barrier a woman must stop believing in, that stops her.
I'm not enough.
I'm not enough. Okay. Saying no, empowerment or guilt?
Empowerment.
All right. So I could say no. And Dr. Reema, people talk about imposter syndrome, personal struggle, or a systemic issue?
Personal struggle.
Personal struggle. All right. Diversity in leadership, symbolic or strategic necessity?
Strategic necessity.
All right. So, running an organization and coming from you, Dr. Reema, so the third one is high pressure career, sacrifice or choice?
Choice.
All right. Okay. So, Dr. Sunita, so in terms of leadership, competence or confidence, what matters more?
Oh, you're tough. You didn't ask such tough ones to Reema and Neha. Competence or confidence? I would say competence. Because if you're not competent, it's tough to be a good leader.
All right. So once you have that confidence
It gives you confidence. Yes.
All right. Great. Career break for maternity, pause or power reset?
The right answer would be power reset.
Okay.
But, and I think we should look at it like that. That, we're just resetting for the next phase.
Right. When I heard, Indra Nui heading PepsiCo, and after that, when people were asking, she went through this, that yes, I continued, but then there was always that guilt. And Dr. Reema feels that guilt was, is not be, the way that we should really look at. But, we all as moms maybe go through that, maybe can mom have it all, maybe, right? Okay. So women in healthcare, many at entry or few at the top. Why?
Many at entry, I would say empathy. Healthcare lends itself well to women because women are naturally empathetic, and it's a good career option for them. Less at the top, I think your own statistics showed only 1% of women are board members. I found that interesting. Only 10 to 24% are in leadership roles. So, not just in healthcare, overall, I think women are not in leadership roles. And it's time we really raised our hands. And I think one way to be a leader is to keep, saying, I'll take that. I'll do that. Really raising our hand and performing and showing that we can, and pushing our way really up. I talked about chief dreamer, but really it's chief pusher. Constantly pushing to get up there.
Yeah, and then I think maybe one quick comment this one, and as I chose and we selected you three, and all of you agreed very first go. Then I realized that all of you have someone behind you in your organization. So I think that's a great luxury. So just one quick thought on, so the person that is really very strongly behind you and that you worked and, that worked for you. Yes, go ahead. Yes, Reema.
Yep. I think I would move away from the cliche. Of course, my business partner and my husband and all those people are there. That is their job to be there. But I think I would really acknowledge my kids. I
Okay.
think they have not, I was telling about not making them, making us feel guilty. I think they have worked on that. And they give me that space. And they say that, Mom, when we grow away, go and, grow up and go away, what would you do for the next 40 years of your life? You need to work. You need to be busy after you're 60. So do whatever you have to do. So that's, I think I will give it to them.
Okay, great. Sunita?
Well, I'll come to who, but I think taking off from what Reema said, I think it's important we raise our kids so they don't use guilt on us. I think guilt is a very negative emotion, and many times because we feel it, we inculcate it in the home. So I also, with my kids, would never let them make me feel guilty. And I would say, hey, this is something I do. I worked really hard to get where I have, and talk about it and say it doesn't mean I don't love you. I love you so much, and putting love at the top of it. So I would resonate with Reema, but I think for me it would have to be my hubby. I find getting an egalitarian man who is celebrates my success, is able to really look after the kids for 3 weeks at an end if I'm away at work for meetings and conferences, has made a huge difference. But I don't think it has to be one's husband. I think it could be, a mom or a friend but I do think we need a bandini in that sense, somebody, who we can sort of count on to help us on this journey. And it's good to create that little support system for ourselves,
Right.
wherever it may be.
Perfect. Yes. Yeah, over to you, Neha.
I would answer this differently, although I would completely resonate with what both of you all said. Cannot disagree on that at all. Kids definitely, husband definitely, probably my biggest cheerleader would be him. But I feel, I think it's the entire ecosystem around you. It's the whole support system. We cannot expect everything from that one person. So, I would probably need my girlfriends one day to just catch up and vent out everything. About work, about personal life, etc. I would need my kids one day, where they're clapping at me, sitting in the audience and saying, Mom, you did such a fabulous job. Or my husband who's supporting me through the entire journey and has always been there for me. So I would say it's really the entire support system of them, parents, in-laws. I think all of them put together really come together to make it happen. Yeah.
Yeah, I think that sums it up. When we talked about the empowerment, when we talked about this, that building that support system,
Yeah.
yes, we all know that we are ready for this hard, work and journey, but then we build, our own, system of support. And I think that on that positive note, we kind of come to the end of this fantastic, the women that I really appreciate, the women that I really think are really doing a great, work and, their own companies and things like that. So I think this is a great inspiration, I hope, I'm sure, for the youngsters who are watching. And so let's get back to Dr. Deepa, if, how we go, and it's almost time and we are ready to close. Yeah.
You guys
Yeah,
are
over to you.
fantastic. Actually, we call it as a mom syndrome. That is the feeling of guiltiness. I think each one of you have really lifted our spirits today. And thank you so much for this insights. I want to capture this moment with all of you. I would request whoever possible, please enable your videos to my participants. Kindly enable the video so that we can capture this moment and cherish forever. Right? I'm just removing the pin, a spotlight from all of you, so that will spotlight everyone who have attended this event.
Yeah, you can't just see us. We want to see you too.
Yes,
Yeah.
yes. Yeah. So we now everybody is ready to, be around and for a photograph. And I think I'm extremely grateful and, thank all the participants who have really been through this whole 1.5 hours of discussion and talking and listening and, and everyone that who have joined, and special thanks and to Dr. Reema, Dr. Sunita, and Neha. It's been a wonderful, and I think now I look forward to a day where we all get together in face to face and physical. And I think this is as good as it's possible, but I still think in person would be even better. Yeah. So keep your smiles on, and I think people are taking photographs.
Yes, I know we are taking the photographs. I request everyone to enable their video if possible, and we will be definitely sharing this in our profile, in our social media profiles. Do check for this, and also we have recorded this discussion so that you can listen it whenever you are feeling down. Right? Okay. Thank you very much. I hope my IT team has taken up the photos. And special thanks to Kedar sir who have joined us, and Chetana ma'am, our well-wishers who have joined us today along with our faculties. For the next discussion, I would like to take Sakshi to take up the next part of the session. Over to you, Sakshi.
Thank you, ma'am. Moving ahead, I would like to invite Joyce ma'am to join, Senior Officer Admissions and Marketing, for a quick announcement.
Thank you, Sakshi. Good evening, everyone. Happy Women's Day to all of you. So, on the occasion of International Women's Day, we are delighted to announce a special opportunity for the aspiring students. From 9th March to 13th March 2026, our institute is offering a free coupon code for application fee waiver. This initiative aims to encourage more students to take the first step toward their academic journey with us. We invite all interested female applicants to make use of this limited time opportunity and submit their applications. Let us celebrate the spirit of Women's Day by opening doors to education and new possibilities. Further, you may connect me and my contact details will be displayed in the chat box. Thank you. Over to you, Sakshi.
Thank you so much, ma'am. So, as we come to the end of today's session, I would like to sincerely thank all of you for joining us for this splendid seminar. We truly appreciate your patience and involvement throughout the webinar. We will be organizing many more informative and engaging sessions in the near future. To stay updated on our upcoming webinars, events, and academic initiatives, we encourage you to follow IIHMR Bangalore on LinkedIn, YouTube, and Instagram. And thank you once again for joining today's session. We hope you found it very insightful and valuable. Have a wonderful evening ahead.
Yeah, thank you all. And yeah, I just, I know there are, maybe just 30 seconds if my panelists allow. Maybe Dr. Kedar, sir, do you want to come in and say something? And, yeah, just 30
No,
seconds.
great thing is in civil services, representation of women seems to be far better than what you said in health space.
Okay.
In fact, when we joined the service, it was around 10 to 13%. Today, it's 40 to 43%.
Wow.
Among the civil services. So it's a very, very good situation. I think we need a lot of people to counsel them also in future, because the work pressure and balance will be very difficult for them. But I think they know how to, they learn to handle it.
So healthcare has more women, sir, only in the top level is where we are looking at. Yes, you're right. Okay.
Unfortunately, no. Unfortunately, health sector has been like it's balance sheet led rather than heart led. At the lower level, it is heart led. That's why more women are there. At the management, it's more balance sheet led, not heart led. So obviously,
Okay.
women are not allowed where heart should be working.
Okay, all right. So a new thought, anything? Yeah, Dr. Reema, very quick this one,
Yep.
and we can, yeah.
Yeah, very well said. I think it's done. In civil services, the females give the exam and they have no choice but to get selected because it is unbiased selection. Don't
Yeah.
know, right? The marks are there, but over here, when the interview has to be done, and people thinking they already have in their mind, you know, the bias that
Mhm.
she's a female, she may not know what numbers are, or she's a female that she may
Okay.
not know. Yeah, so that mostly it is that. Or she is a female, she may not know how to push people around. So I think it's a bias, the altruistic bias that people come with. And when you see a tall person coming in, you will by default think that this person is a basketball player, which may not be the case. So
Okay.
it's just that.
Okay. Thank
But
you.
wonderful, wonderful, Usha. It was really, after I think long gap, I've seen such a wonderful webinar. Wonderful.
Thank you.
Great.
Thank you, sir.
Very
Thank you.
fantastic to all the
Very
panel
much.
members. Remarkable, remarkable.
Yes. Thank you. Thank you,
Thank you.
all men and women so who have joined us. And once again, happy Women's Day. And so thank you all. And thank you, Neha, Dr. Reema, Dr. Sunita. This was wonderful. Thank you.
Thank you.
Thank
you.
you.
Pleasure to be
Bye-bye
there.
now.
Thank you.
Thank you, ma'am.
Thank you.
Thank you all the panel.